our stocks for tenofovir, lamivudine, dolutegravir, that is TLD packs of 90 tablets, which is the main ART regimen being used by over 92% of all ART patients, both adults and children. Currently, there are 2,026,555 packs at both KEMSA and MEDS, translating to 4.7 months of stock. Over 4.8 million packs will be delivered between now and June 2025, which will increase central level stocks to over 11 months of stock by end of June 2025. Secondly, abacavir, lamivudine, these are dispersible tablets, packs of 30s, which is the first-line ARV in pediatric patients administered together with dolutegravir. Currently, there are over 326,000 packs at KEMSA, translating to over 7.4 months of stocks. There are plans to introduce a fixed dose combination for August 2025, and we have over 18 months of stock of this product, which are on order with scheduled deliveries from June 2025 onwards. Ladies and gentlemen, we are pleased to report that we have secure stock levels of key ARVs and testing kits, with supplies ranging from several months to close to 2 years. Specifically, we have adequate supplies of TLD, pediatric ARVs, nevirapine suspension, and other HIV testing commodities. We are also ensuring consistent availability of early infant diagnosis and viral loading test reagents. These ARVs used for infant prophylaxis as part of elimination of vertical transmission of HIV. Currently, we have 510,000 bottles of meds at meds, translating to 8.4 months of stock. All these stocks is at meds and forms part of the consignment that we will be flagging off. So our children will be protected from transmission of HIV from mothers. Equally, for the male condoms, we have 1.6 million pieces of male condoms, and there was a recent distribution of over 9 million pieces to health facility. Again, the ministry is expediting the delivery of 28 million pieces, and an additional 93 million pieces is under procurement at KEMSA. The country has fully transitioned to the 3-test algorithm, which utilizes 3 different tests, screen and confirm the HIV status of individuals. For the twin screen, currently there are 8,330,300 tests at KEMSA and MEDS, which translates to 10 months of stock. Additionally, there are 1.4 million tests of the HIV syphilis duo test kit, that is standard Q, that is used for screening in antenatal care settings. This translates to 14.5 months of stock. The one-step kit, currently, there are 565,575 tests, translating to 21.8 months of stock. And for the first response, 348,770 test kits, translating to 21 months of stock. For early infant diagnosis, this is a test done to determine the HIV status of infants exposed to HIV, and the test is performed in 9 testing laboratories in the country using the Roche platform, and we currently have 18,432 tests at MEDS. This translates to 1.7 months of stock, and the ministry is expediting the delivery of 52,608 tests by April 2025 to support uninterrupted service delivery. Kenya has an estimated 1.4 million people living with HIV, and we have made significant progress towards the UNAIDS targets 95, 95, 95, having achieved 98, 98, 94. The supply chain supporting people living with HIV is efficiently coordinated by KEMSA, MEDS, Ministry of Health, county governments. Just 2 days ago, government policy makers and the Council of Governors convened in Nairobi to discuss current challenges and work towards lasting solutions. I take this opportunity to express our sincere appreciation to PEPFAR for its unwavering support over the years, and most recently for reviewing the stop order that had paralyzed operations within MEDS. As a government, we applaud this gesture of true partnership and assure you of our continued commitment to supporting the HIV response.
It is important to urge the county governments, the faith-based facilities, to ensure fair, efficient, transparent distribution of these supplies. This is to avoid stockpiling in certain facilities or by specific individuals while others are suffering. It is our share. So can we distribute these commodities in a fair manner? And they must reach each and every person they are intended to reach. I want to assure everybody that there is no crisis at present. We are going to manage any crisis in the health sector and steer the health department to better levels with the lead of Waziri here. And while the reinstatement is a welcome relief, ladies and gentlemen, it's a wake-up call that this highlights the urgent need to address donor transition challenges. Across board, globally, these dwindling funds, including our internal resources that we are living in a fiscal space, but we equally need to think broadly. How do we sustain the impact that has already been made so that we don't lose the gains?